Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning. Good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And today we're going to talk a lot about some health issues that we all need to be very cognizant of, that we kind of ignore sometimes, right? And part of that happens because we're busy. We're entrepreneurs. We're small business owners. We're moms. We're dads. We're this, we're that. And we kind of let some of these things go. And obviously, when our health declines, it doesn't matter what we're doing with our business because we're not going to be able to enjoy it. And so with that, please join me in welcoming Dr. Christie-Michele Hogue to our program today. Welcome, Dr. Hogue. How are you doing?
Oh, thank you so much. I'm doing well. So excited to be here with you today. So thank you for having me.
We're going to have so much fun. But let me tell people a little bit about you, and then we will jump into this. So Dr. Christie-Michele Hogue is a geriatric-trained dental practitioner who is dedicated to providing dental pearls for general dentists, primary care physicians, geriatricians, nurses, dieticians, and all healthcare providers concerned with the oral care needs of geriatric patients. She is the CEO and founder of Mouth Mirrors, LLC, an online education company established to help bridge the gap through knowledge and education with an interdisciplinary approach to learning. The overall goal is to encourage health professionals to render compassionate, competent, comprehensive care for the oral health of our most vulnerable older populations. And, I love this because, according to AARP, I'm in that age range, but, it's one of those things where we often don't think about our dental health, right? But, before we jump in, I always like to know how it is that my guests got to where they are today. So how did you decide that this was something that you were going to focus your career on?
Okay. Well, actually, I knew dentistry. I wanted to always go into healthcare.
Okay.
And in high school, we had to do a paper on occupation of our interest.
Okay.
So I actually did dentistry. I was always intrigued by my from the other side of the spectrum, my pediatric dentist, Dr. Williams. I loved going to the dentist, unlike a lot of people say. And so I did this report on dentistry, and from there, I had the type of mom that will always submerge you. I shadowed a dentist and went on, and I knew that was the course that I wanted to take.
Okay.
So I actually, through dentistry, went through dental school, and I developed the niche in geriatrics, just basically because my grandparents, I witnessed them experience ageism on several levels. My paternal grandparents, my grandfather lived to be 95, and my paternal grandmother lived to be 101.
Holy cow.
Yes, and all live within their right minds, fully functional and everything. So it was one point my grandfather did have high blood pressure. He was a walker throughout his life. So I think that helped to sustain him. But although he did have high blood pressure and congestive heart failure, the doctors would say like, oh, we don't really see any need, to continue him on this medication. They were kind of writing him off.
Right. Why bother?
Right. Why bother? And from there, he actually lived like an additional 10 years. This was when in his 80s, but he lived an additional 10 years. And it always, for me and our family, that was 10 more Christmases or 10 more holidays, that we were able to actually have memories as opposed to just being counted off as a number or looking at as a patient. So although I was not in the medical field as a physician, as a dentist, I was led to understand the neglect that is often found in oral care for older adults.
Right.
And that's how I kind of stepped into that. I did a lot of my clinical practice within the VA and Veteran
Mhm.
Affairs Medical Center.
Mhm. And bless you
So
for that. Thank you.
thank you. Thank you. So we do work with a lot of medically compromised patients.
Mhm.
And so geriatrics is not just only about those that are aging, but it
Mhm.
is has a lot to do with the special needs
Mhm.
of patients who may be in a vegetative state, but
Mhm.
they're in their 40s or 50s, you
Mhm.
know, so you have to be able to have the skills to kind of manage their
Mhm.
oral care because it's still important and it does have an impact
Right.
on the systemic health.
Mhm.
And that's often the thing that's
Mhm.
forgotten.
Right. Well, and I love that you work with other medical care providers because they might notice those things, and say, hey, how long has it been since you've been to the dentist,
Right.
and things like that. And like I said, we sometimes don't do it. I'm like you. My dentist when I was a child was wonderful.
Right.
He just I did not in any way fear going to the dentist, which I know, that is one of the big things. People
Right. It's
will,
like a
they'll do
anomaly to
anything
say that
before
now.
going to a dentist, right?
Right.
And so I loved him, and that got me into the habit of going to the dentist however often they told me. I kind of have some oogie teeth, and so I have to go like every 6 months, and I'm perfectly fine with that. I mean,
Well, that's
they say,
recommended.
yeah,
Yes.
and sometimes I've had to go even more often than that. But like and I've been very fortunate that every dentist since then has also been good, and so I've never thought I don't want to do that. But so many people put it off, and they put it off starting at a very early age, and then of course it becomes the habit to not go.
Yes, unlike our experiences, so
Mhm.
many people have experienced a
Right.
traumatic, have
Mhm.
have had a traumatic
Mhm.
experience in their dental appointments,
Mhm.
or they're experiencing it through the bias of maybe a parent who has
Mhm.
that fear and is
Right.
like, oh, you're going to get that shot, or so
Mhm.
it's like a developed fear
Mhm.
innately without necessarily experiencing
Mhm.
it themselves. So I think that for me, I took that on as a challenge to dispel the myth. And I try
Mhm.
to greet my patients wherever they are, whether they're kind of holding on to the side of the
Mhm.
chair or if they're happy,
Mhm.
talking to the point where they're trying to
Mhm.
talk over their nervousness. I
Mhm.
try to get to their experience, to the bottom of their experience,
Right.
and then take them from there.
Mhm.
There is a topic that's popular now, and we're actually going to have someone on our podcast soon to
Mhm.
talk about trauma-induced care,
Ah.
and just understanding the
Mhm.
mental health connection with
Mhm.
oral care,
Mhm.
um, whether it's through depression, but then also just through
Mhm.
trauma-induced care. So
Right.
we basically have to be in tune with that, and I think
Mhm.
it's important as dentists to
Mhm.
understand that and recognize that, and then also provide rational care. You don't want to overtreat or
Mhm.
provide for
Right.
patients that may be elderly. You want
Mhm.
to understand where they are, understand
Mhm.
their medical background, understand maybe where they are health wise,
Mhm.
so that you know whether it's beneficial and you're
Right.
making a rational
Mhm.
decision. You don't want to give them a full mouth extraction when
Mhm.
it's going to um, impede their
Mhm.
ability for their nutrition. You want
Right.
to outweigh the benefits,
Mhm.
the risk versus the
Mhm.
benefits. So I just think it's important that you take each patient as an individual
Mhm.
and treat them as a whole, all the
Right.
way up mentally
Mhm.
and oral health wise, as well
Mhm.
as their systemic health.
Right. And to me, dentistry, one of the best things is the preventive care part.
Yes,
You go
yes,
in, and I mean that's why I go in, several times a year is I'm getting my teeth cleaned that
exactly.
often. And sometimes that's not always, I remember years ago because they have like when they're doing the polish, it's flavored, right?
Right.
And for some reason they came up with chocolate.
Oh,
And
wow.
that was the nastiest stuff.
Right.
I mean, I was like, whoever came up with this did not, and of course everybody went, ooh, chocolate, right?
Right,
And
right.
oh no, no, mint is good. But it's also one of those things where when you keep up on it, it is easier if
Exactly.
you have an issue. Knock on wood,
Exactly.
I have never had a root canal. I've got several crowns, and
Yes.
I've had a crown that had to be replaced, but I've never had a root canal. And to me, that's why I do this, right? Who wants to have a root
Exactly.
canal?
And I think that's where health literacy comes
Mhm.
in, because a lot of times we don't understand how pretty much all of dentistry is preventative.
Right.
Well, healthcare also is
Mhm.
preventative,
Mhm.
but for the most part, as far as dentistry, if you're getting your cleanings, you're staying on top of your oral care,
Right.
you won't, and and your home care, because it's not only when you go to the dentist, but
I
it's what
know. I
you
never
do.
floss like I'm
Like
supposed
going to
to.
church, don't just be
Sorry.
at the sermon on Sunday. You got to live right. So with your daily care and maintenance care is also important. That kind of helps to prevent from the caries. And then if you do have a cavity, if you get that taken care of, you won't get to the point of needing a root canal, and so on and so on. So it is a progressive thing, but there's also two sides of the coin, because we have some people who don't go due to just, well, maybe three, just neglect.
Right.
The second one is just out of fear, because they don't necessarily want to. They have a fear of the unknown at the dentist. And then the other issue, which if there's any politicians out there, is the access to care, which is a huge issue.
Right.
So a lot of people their care is neglected because they do not have the insurance to be able to pay.
Because it's not typically under your medical policies.
Exactly. And if we're speaking on geriatrics, then the hot topic is dental care for our older population. We have Medicare services, but dental is not covered. And that's a huge issue, especially for our baby boomer population who has invested in their teeth. And then once they retire, they don't
you can't you can't afford it.
Right, to maintain what you've invested in all of your life. And that inevitably does affect your systemic health and your ability to maintain your nutrition. Pain, frailty, all of it is a cascade. So the oral health does have a very important stance as it relates to overall health. But I think Surgeon General David Satcher said it best in 2000, it's a silent epidemic. And unfortunately, 23 years later, we kind of still...
We're in the same place.
We're in the same place for the most part. But the barriers to care with transportation and most importantly, access to care for certain demographics is, even with Medicaid, although there may be some dental benefits, is not preventative. So just to say that
it's when you have an infection or something like that, then it kicks in.
The only thing that's covered is an extraction versus getting your fillings and having a root canal and a crown that can help save the teeth, because there's nothing like your natural teeth. You can say you want dentures, but there's nothing like natural teeth. So I think even in Medicaid, I think that if we look at it and we're able to provide more preventative care, scaling and root planning instead of just a prophy. Those things are important, because you want to reduce the caries, which is an infectious disease, and you want to reduce the periodontal disease, which is a chronic disease. You want to kind of reduce these things that also play a role in diabetes. It has a cascade with obesity, cardiovascular disease. There's a connection with all of that. So it's important that we kind of tie that together and look at it as just as important as our healthcare.
Years ago, my uncle, and it was one of these things that you never really noticed, but his teeth were all rotten. I mean, they were just horrible and awful. And so the reason you didn't notice was he did this, he covered his mouth. He did not smile. He didn't laugh, so you kind of had that thing going on there too. So like you talk about mental health things. And because he didn't want people to see how bad his teeth were. Well, what we didn't, and he was aging. I mean, he was not elderly, but he looked old. And, nobody really paid any attention to it. And then somebody finally got this man to the dentist and discovered that his rotting teeth were poisoning his entire body. And then you add in all the nutritional things like that were along with there. And he had to have, every tooth pulled and got dentures. And this was long enough ago that, they had to be really pretty strenuous in the care. But the change in him was incredible. All of a sudden he was no longer stooped over, and he would laugh, and he would, but yeah, I mean, it was amazing, because you don't think of your teeth as having that much of an effect on your body.
It does. And your quality of life. That's the biggest thing. Your oral health, your quality of life, your social interactions. People that may not feel comfortable with, maybe they have broken down teeth or they have dentures that are ill-fitting. they don't feel comfortable going out to eat at places because they feel like they either have
Right.
to
They're going to have to order mashed potatoes.
or or they're afraid that it's going to drop. So those are major issues that should be addressed, and a lot of times they're kind of swept under the rug, or people that are having to live with it day to day, they just kind of, I hate to say, suck it up and take it.
Right. It's just the way it is.
But they take it as the way it is, and it shouldn't have to be that way. So that's part of my advocacy as it relates to oral.
Yeah. And as you mentioned, it affects your entire body, mentally and physically. And our beloved seniors have enough issues they have to deal with, hello, politicians out there, like you said, pay attention to this. And if their parents aren't going through these issues, they will, either they will, or, the politicians themselves will be. But like you said, 23 years we've ignored, all of this. But it is something that, and my understanding is George Washington really did not have wooden teeth. But we look back in our history, and it is something that people just have not prioritized. And it's not just here. It's worldwide.
It is,
worldwide. and which is
worse in other countries. So, it's definitely important. I just think that the education piece is really important, and just understanding even when it comes to selecting treatment for those that do have access to care. I feel it's our onus as providers to explain so that the patients can make an informed decision. Just because if you, in certain communities, I'll say even in some African American communities or some underserved communities, all because of things, that we're only taught just to have it pulled, but nobody really explains that, well, you have the option to have it pulled, but we actually can save this by
we might be able to put a crown on it, or
right. So there are other options, and then the education on just basic oral health. Some things that some people think that they're brushing, but they may not be brushing adequately, and if we're never really taught how to brush, and then it's passed down, you're just telling your children, go brush your teeth, but no one's really teaching you how to brush. And then some people say, I brush my teeth, I do, and they're still having cavities. They don't understand why, but the education piece is not there. And also I go back to the oral and systemic health. I went to Howard University, and while I was there, Howard University College of Dentistry, that's where I went to dental school. And while I was there was a young boy, DeMonte Driver, who unfortunately passed due to a dental infection, just due to not having access to care. There are certain areas in the mouth, what we call the cavernous triangle, where there is no barrier. So a dental infection can easily travel. The infection can easily travel to the brain.
Yeah, into your brain.
Exactly, travel to the brain. So these things are important to educate our community so that you're not taking these things lightly. And also I'm sure the ER doctors can say they see a lot of patients that come in with dental pain, dental issues, because they don't have access to do the preventative care like we spoke of earlier.
Yeah, and so they come in with an infection, with all sorts of issues.
And you're kind of just treating that problem there, but never getting to the root of the issue.
Yeah, they give them antibiotics to clear up the infection.
If you don't deal with the source of the etiology of the infection, it's just going to come back. So yes, it's definitely.
And it is, and it's not just teeth. There's oral cancers. There's all sorts of other things. And I always get a kick out of my dentist who, I really like, or I would change dentists. I'm like that with any, if I don't like my provider, then I go somewhere else. And the nice thing is I have that luxury where I can do that. But, he's always doing the now stick out your tongue, and I'm like, because he's checking for, oral cancer.
To do those oral cancer screenings. Yes. Well, and I must say also for our viewers or listeners who do not have teeth, it's still important to go to the dentist annually for that oral screening, because a lot of people feel like, I don't have teeth, I have dentures, but you still can develop a lesion or oral cancer that needs to be assessed. So it's important to get that screening annually.
And granted, if they're going for, say, an annual physical with their primary care doctor, They might look, they might not. I mean,
And that's so true.
mhm,
So again, if I can get on my little
mhm,
soapbox, I always urge as a
mhm,
geriatric trained dentist
mhm,
who has been trained under some geriatricians
mhm,
and physicians, I always urge our especially our geriatricians,
mhm,
but also our general practice and
mhm,
family practice physicians to do those basic oral
mhm.
exams. We also at Mouth Mirrors, we can train the trainers. We try to teach you how to do those oral care exams,
Okay.
just the importance
Mhm,
of or the oral exam,
mhm,
because some people don't have access. You're the only provider that they're
mhm,
seeing as their physician. And
mhm,
if it's not brought up about oral care or the importance of
mhm.
oral care, some patients still don't feel that it's as important
Right.
because they may not have access to a
Mhm.
dentist.
Right.
So
Well,
it's important
and
to
a
know
lot
what
of time the primary care doctor or geriatric doctor may assume they're going to a dentist.
exactly. And unfortunately, a lot of times that's not the
Mhm,
case. Yes. So we just want to kind of provide that access.
mhm,
And the other roadblock that I often find is some geriatricians who actually want to advocate and
mhm,
send patients to their dentist, but they just don't have the insurance or the
mhm.
access to care. So
Right.
even though they say they want to refer them, the patient can't
Mhm,
go because
mhm.
they don't have the resources.
Right. Yeah, because as we said, most insurances, a standalone, you have to have separate insurance that is dental insurance.
Yeah.
And that's gotten more complicated. I mean, like, my husband and I both totally as a fluke go to the same dentist. I mean, it was one of these things where,
Right.
it was, why
So
are you
fast.
getting mail from my dentist? Well, because it's my dentist too, right?
Right.
And so, but they no longer take one of the large dental providers. They don't accept it. Now
Wow.
and so we have to pay when we're in there. And then they will bill and then we get reimbursed. So it's not that we're out of pocket, but there is that gap in there, where you're waiting to get paid. And unfortunately, we are at the age where, typically when you're in, it costs a little bit more.
Yeah.
And which, in many cases, then people are going to go, no, I got a car payment, I got a mortgage payment, I got to eat. So
Exactly.
they're not going to do that. And so, that's an insurance issue, if and we asked them, we said, why are you no longer accepting the big guy? I mean, it's Delta Dental, right? I think they're probably one of
Right.
the biggest. And they said, because they pay so slow.
Wow.
Now, the funny thing is they reimburse us just like that.
Like that. Wow.
And so once it's submitted, we get reimbursed really fast. And so it's not that the funds aren't there. They
Right.
just pay the provider slow. And so that is a totally different advocacy issue.
It,
Those providers need paid because they are a business. Yes, they
exactly.
are providing this service, but they have mortgages, or they have rent they have to do, they have
Have
employees they have to
employees they have
pay.
to pay,
And if
right?
the insurance providers are slow on paying, they're gonna have to do like I said, no longer accept the insurance.
Right, right. Yes, that's definitely an unfortunate case
Mhm,
and far too often the
mhm.
case. So
Right,
yes.
right. And it is, as we said, it is just absolutely so important because it's kind of like the top of your body, right? It is the
Right,
top of your body.
right.
And so then everything flows down from that. Your digestion, your mental health, I mean, all of that
It's
is.
the start of our digestive system. Our
Mhm,
oral cavity is the beginning of
mhm,
the digestive system. So
mhm.
it's important
Right.
that we watch what we're eating,
Mhm,
how we're eating,
mhm,
the importance of being able to actually properly chew your food so
mhm,
that you can develop what we call that bolus to swallow properly.
mhm. Right.
So yes, it definitely is
Mhm.
one key thing.
Right. Speaking of that, and it just popped into my head, so I'm not sure that you can discuss this, but one of the issues with seniors is when they have dementia and Alzheimer's, and so chewing and swallowing is more of a challenge. And
Yes.
so, do you work with your patients on that, or how does that work?
Well, if they do have dementia or some
Hmm.
of the other more challenging cognitive
Hmm.
impairments, a lot of times it comes to working with the caregivers
Hmm.
and working with the nurses, depending on if the patients are homebound
Okay.
or if they're in long-term
Hmm.
care institutions. And then also, I think it's important in knowing your patients so that you're able
Hmm.
to kind of recognize when
Right.
there is a change
Hmm.
in their mental status or maybe
Hmm.
a change in the way that they may come in a little more disheveled. Sometimes we are the
Hmm.
ones that are recognizing that,
Right.
from a patient that kind of keeps
Hmm.
themselves up a certain way,
Hmm.
and then maybe they may be going through a depression,
Hmm.
different things like that. As a dental provider, I think it's important that you kind of um, keep an eye out for your
Hmm.
patients
Right.
But as it relates to, back to your question, the patients that have cognitive impairment issues, I we again with mouth mirrors, that's what we're here to train the trainers, for nursing homes, for long-term care facilities, help them get in place programs, because what we find is a lot of times with the long-term care facilities, on the charting, maybe oral care is just a check mark. So
Okay.
you may have like a patient that is a little more resistant. So understanding basic techniques that you can use to kind of help overcome some of those barriers for patients. And then there are some days when the patient just doesn't want to be bothered, and that's okay. But
we're all like that, right? Leave me alone.
Right. But it's important to know, just to kind of circle back. And it's a lot of times I found in my experience, it's all in your approach. So if you come to the patient in a caring and basically speaking to them and explaining to them what you're going to do, instead of just going forward and doing it as if it's a job, I think it's important to kind of speak to them and explain to them, especially for those that are cognitively impaired. I don't want to catch them off guard because they may become combative. There are several different ways you can look at it. Additionally, patients that have had neurological issues such as a stroke or Parkinson's disease, where maybe their muscles have atrophied in the
you might have to have a therapy.
Exactly. And a lot of times you'll find that patients pocket food. So a lot of times people will say, oh, they're just keeping the food in, but it's because of the weakness of their muscles that they're not able to kind of chew the food as well and swallow it. So I say connect with your speech and language pathologist, because we all are a team when it comes to helping those patients as they get to advanced stages.
Yeah, because it's interesting. Sometimes people literally forget how to chew and swallow.
Yes, we do find that in the advanced stages, especially like with Alzheimer's disease in the advanced stages, patients may forget to chew, forget to eat.
Or they chew and they don't swallow. And
right. So a lot of prompting is important to kind of prompt the patient. A lot of times they'll have one-on-one sitters that can kind of sit and help prompt the patient. If caregivers, a lot of times we find that a lot of the spouses are caregivers, or children are caregivers to their parents, and you want to kind of know your parent or know your spouse to kind of prompt them. But it's important a lot of times, because we get so overwhelmed with everything else in caregiving, that oral care is often forgotten. But it is important because there's you can aspirate the bacteria that develops in your mouth, and can lead to aspiration pneumonia. So there's several different areas where oral care is important, just because it will lead to other issues down the line.
Well, and again, it's the approach. It's not saying swallow your food. It's, I mean, and
I'm gonna brush your teeth, open up.
And we all, hopefully recognize the fact that many times, someone with dementia or Alzheimer's or, some other cognitive thing regresses. And so, sometimes it's, chew and chew and chew, like you talk to a child, right?
That is a technique. Sometimes you want to sing along with the patient. You can say, we can go through some of the techniques, but, kind of hold their hand and helping them with it. Coming from behind, you always want to kind of face them so that they know what's going on, so that you're not startling them. But yes, we do.
Yeah, because then they're going to choke and you're going to have a different issue.
Have another issue, right? We don't want that. Yes, but we do go through a lot of those techniques and with our train the trainer session. And then also, like I said, we teach peers for nurses or other healthcare disciplines, but then also some of our students that are coming up, as I've taught a lot of medical residents, even as a dentist, just the importance of oral care as it relates to the older adults, so that they're aware and able to train their staff on what to do. Because a lot of times is we don't know what we don't know, or things that we take for granted. So it's important.
Yeah, because we're thinking they're 80, 90 years old. Of course they know how to chew and swallow.
Right.
But, and like I said, I still don't floss like I'm supposed to, right?
Right. And I think it's also important just to also pay attention, because they may not be able to express to you if they're feeling pain. But there may be certain things where they're holding their jaw or grimacing when they're eating or chewing. You may notice that on one side they try to avoid. So you want to kind of watch those different things.
If we're doing a little chipmunk over here.
Right. So you want to make sure, because that may be something where you may want to take them into the dentist to be assessed, because there may be something going on, but they're just not able to express it to you due to their condition.
Right. Well, and sometimes we just don't even recognize it. I was on vacation a year or so ago, on vacation, of course, because this never happens when we're at home. And
Right
my
at home
gold
down the
crown
street.
popped out. I'm sitting there looking at my gold crown at 10 o'clock at night in this hotel room, going, "This is not good."
Right.
And so got into found a dent. I did multiple phone calls the next morning before I found one who would get me in on an emergency basis. And went in, nicest man in the world, and and he said, "There's no point in me." He said, "Does it hurt?" The key, right? And I said, "No, there is no pain," which was very strange. I mean, my crown had popped off. And he said, "Well, as long as it doesn't hurt, I'm not going to do anything to it." He said, but he said, for the rest, until you can get in to see your dentist, you're on one side, right? So it meant that I couldn't have the steak that everybody else had, and all those, because but what happened was I got into, and I mean, I saw my dentist within a week. I mean, it was, because my next call was back to here to say, eep, eep. And obviously they got me in very, very quickly. But, I got into the habit of chewing on one side and didn't even realize that I wasn't chewing on the other side until weeks later. I mean, it was kind of one of those things where I finally realized, wait a minute. And so, I mean, that happens too. We just, we get used to, chewing on one side and don't even stop to think, well, why am I not chewing on the other side? It doesn't hurt.
Right. Exactly. But I want to say you did the right thing in trying to seek out your dentist. And at least he was able to tell you that everything was stabilized. But we just always want to push that every time, even though things don't hurt, it doesn't necessarily mean
right. Oh yeah. I still needed to go in.
Definitely. So you were on top of it, which is the good thing.
Well, and it was one of those where my first thought was, oh, if this screws up, I am going to have a root canal, right? That's the big thing. But yeah, I mean, it was just because I'm like, and it was, I thought there shouldn't be something crunchy in my mouth, and then and luckily I didn't swallow the crown. But yeah, it is one of those things where we don't really, or we get used to it. Oh, it's a twinge. It's a twinge. Or shouldn't chew ice on that side, or watch the coffee, all of those things.
Right.
And there's an issue. I mean, your body is saying, excuse me.
Exactly. I know I heard one dentist before, I always speak of having a tooth extracted. It's like an amputation, which is true. A lot of times we'll just say, oh, just pull it. But this is a part of your normal anatomy. So you want to look at it as like, it's not necessarily an part of aging to lose your teeth. Although
I mean, there are people who are in their hundreds who have their teeth, right?
That's not a natural part of aging. I want to dispel that myth, but it does happen over time due to different things or poor maintenance, but it doesn't have to say that aging.
Right. Well, and as you've been saying, keeping up on those things. The last dental procedure that I had to have a filling replaced. And and they were blessed, like I said, love my dentist, and they were apologetic, and I said, you need to understand this filling is over 30 years old. I'm like, as a natural thing, that the tooth was probably going to decay around that. I mean, that was and it was this very simple, short little procedure, which was really funny because it was right after I had my thyroid removed, like 2 days. So I could not speak at all. And so I had, when I got to the office, I had told them, I said, it's not COVID, right? No need to be afraid, and all of those things. And so, I was able to write notes and do all that and explain, I had surgery and I had a bandage. I mean, it was pretty, but, and so they said, oh, he might not want to do this. Okay. And so I go back in and they get me all prepped, and he, of course, had no problem with it, but they gave me a clipboard so that if there was an issue, I could write on it. And I'm thinking, if there's an issue, I'm just gonna whack him with it.
Right. That's how you get to write it out.
I'm not gonna write "ow." I mean, but there was no problem at all. Awesome. And so, but it was like, okay, but it the clipboard had allowed me to write to him, here's what's going on, here's why I can't,
So use the clipboard to whack, right?
no, keep us posted. No, I'm just gonna whack
Right.
him. But what that shows though is you need to have open communication, and because I told them, okay, I'm not sick. This is why I have no voice. And of course, COVID just totally through dental care. I mean, that was, and that was one of the things where I think so many people may have gotten used to not going,
right.
because that was not good.
We had patients in the middle of getting crowns that had to stay within the protective because the offices were closed. Yes. So we definitely have to try to get back on track with that. But unfortunately, COVID was not a positive.
Well, and I mean, there's still all, you go in and you feel kind of like, you're a hazardous material because they're still in gowns. They're still, they still have the shield and the masks. But I mean, the mouth is obviously the germiest place in your body. And so they're, it's we shouldn't be surprised that they're protecting themselves.
Right. And it's just, I guess, an advance with our, what we call the PPE. I know in the early 80s, even before people didn't wear gloves, and then there was the infectious of HIV and different other infectious diseases where we had to start wearing gloves. So now, we're going to add more to the PPE, your protective wear. Yes. So.
Well, and just little things. I mean, I remember deciding not to go back to a dentist because she didn't have like the big light.
Right.
She did not have any covering on it, on the handle where she touched it over and over again. And I was so used to that being completely done every time. And I was like, I'm just not wild about this. Now, she clearly felt that it was okay, but it was like, And so of course the impression was if she's not as attentive there, maybe she's not attentive on other things.
And that's so very true. Yeah. It's very true. Yes. So that's something you do want to look for when you go into your dental offices. As a patient, you want to be your own advocate. Well,
and I talk to people about that all the time. And we actually talked about that because you had me as a guest on your podcast. I was very honored to be on Aging Pearls. And it's a great podcast. But like I said, AARP may think I'm in that category, but I don't put myself there. But we talked about the fact that you have to advocate for yourself. And if you can't, you have to have someone who can, which is one of the biggest issues with seniors. And so if you are a caregiver, whether you're family, whether you're a medical provider, whatever, you have to be advocating for those that you're taking care of.
Exactly. And kind of push forward with that and speak up for them, even if a provider says something. I know I was just this is another example with my grandparents, but my grandmother, who was completely a dentureless and she wore a complete upper and lower denture, was complaining about having pain. She was like, every time I just touch right here, I would just touch right here. The pain just shoots up on the side of my face.
Yikes.
That's how she would describe it. She was like, shoots up. And I'm thinking back in my textbooks, like, in my learning, because I was recently out of school.
So you're trying to be granddaughter and dentist at the same time, right?
Right. And I'm like, that sounds like, I remember the name so clearly. It was tic de la rue. It's called trigeminal neuralgia, and it gives that shooting or
that zing.
Yes. So she was just saying, just when I put my denture in. So I actually I flew down. She was in Ohio, and I flew down to go with her to her dental appointment. And the dentist was trying to just make the adjustments with the denture, and then he sent her back, like, try this, which is what we do. But I was saying, but what she describes, and I feel that as providers, we have to really listen to our patients because they may not be able to explain exactly what's going on in the terms that we see it, but we have to kind of hear through what they're saying. And I was saying, she's saying it's a shooting pain. It's not just like, when she bites down and it's only in one area, so it's just like, she needs to go see a neurologist, And of course he's looking at me like, you think he's just out of school and everything. But actually she did finally get that referral, and that's exactly what it was, the trigeminal neuralgia. And he came back and said, like, out of I think he had said he practiced for 30 years, he had only seen it one time.
So she educated him.
Right. But it was just interesting how, I just always say we have to listen to our patients, and as opposed to just kind of getting what they're saying. Sometimes what they're saying is a little deeper than what
Right.
we hear or what they're able to
Right.
express.
Well, and we as patients have to tell you what's going on.
Right.
That's one of the biggest things that I talk to people about, and especially medical care providers is, they will say, so Deb, how you feeling today? And I'll say, fine. Right.
Right. I mean,
And
everybody, I'm
that can
okay.
mean anything from I'm going to run a marathon
Right.
or I'm about to keel over.
Right.
And so you
Exactly.
have to pry and you have to ask a little bit more. And it's so funny because I see lots of doctors, and all the time.
Yeah.
And so I do hunky dory. So, how you doing? I'm hunky dory today.
Right.
And so they know, okay, that's good. And if I ever don't do that, then they know there's an issue.
Exactly.
But we do expect people to read our minds. I remember my father, he would have been in his late 80s.
Okay.
And I went to, he lived up in the mountains of Colorado, and I happened to be there, and he had gone to the doctor, medical doctor,
Mhm.
who was only 4 years older than me. And so that was part of this was, oh, he's just this youngster. And
Right.
he'd known him since
Right.
he was, 6 years old. Right.
Right.
And so he had two issues. And so he went to the doctor, he came home, and I mean, he's very independent. He didn't want me to go with him, so I didn't take him,
Right.
but he came back and I said, well, what did he say about this? And he said, oh, such and such and such. And I said, well, what did he say about the other? Nothing. What do you mean? And he
Right.
said, well, I didn't tell him about it. I said, what? And he said, he should have known. And I said, he's not psychic.
Right.
So I picked up the phone and I said, Mike, he's got to come back.
Right. Right. Tell you about this.
And I think that is part of it, though. We joke, but we do assume that our medical care providers are very well educated. We're not assuming that they are very well educated, but then we assume that they should know what's going on with us. And we're not bothering them to say, I got this weird twingy thing going on.
Exactly. I think it's important in it's important on both ends for the
Mm-hmm.
provider and the patient for the provider to kind
Mm-hmm.
of dig a little deeper, and like you
Mm-hmm.
said, for the patient to kind of explain everything
Mm-hmm.
that's going on, express everything that's going on, but for the provider to also look a little deeper to
Mm-hmm.
understand that what they're saying, are they
Mm-hmm.
really saying this?
Right.
Watching body language, like you
Mm-hmm.
said, you come in and you say, oh, I'm okay, but what does okay really mean?
Right.
So
Yeah. Am I smiling and laughing?
right.
Mm-hmm.
And I think that a lot of times, and even a lot of times with our older population, we come from that paternalistic
Mm-hmm.
thought process where whatever the doctor says, that's what I'm going to
Right.
do. I'm
Mm-hmm.
not saying that
Mm-hmm.
you shouldn't do that, but it's important to explain everything so
Mm-hmm.
that you can help, and for the doctor to explain everything
Mm-hmm.
so that the patients can make an informed
Mm-hmm.
decision as opposed to just what they're being told to
Mm-hmm.
do. So I think that is a big key to
Right.
kind
Right.
of educate our patients and
Mm-hmm.
kind of not speaking the jargon, but kind of tame it
Mm-hmm.
down, speak in layman's terms so that
Mm-hmm.
our patients are understanding exactly what we're saying. And sometimes in the case, tell, show, do, let the patient explain it back to you to make sure that they have an understanding of what you
Okay.
said.
Mm-hmm.
Yes, I think it's important.
Right. Right. So, we've taught you specialize in geriatric care, and you're a youngster. Do you
Thank
find that causes issues? And I always think it is very important, whatever we do, that we find our niche and we develop that. But do you find it's a challenge because you are many years younger than your patients?
Yes, I find it a challenge a lot of times, even with some of colleagues, who
Mm-hmm.
may feel that I'm just kind of younger
Mm-hmm.
uh in the field, but
Mm-hmm.
it kind of has made me to be a little more well-read. I think you have to be a little
Okay.
more on
Okay.
top of your game because you know that people may have certain
Mm-hmm.
expectations, whether it's a minority in age,
Mm-hmm.
race, any
Mm-hmm.
any area. I think
Mm-hmm.
it's important that we kind of are well-read, and I feel that that's important on behalf of my patients to be able
Mm-hmm.
to speak on their behalf, even
Right.
if it's to another healthcare
Mm-hmm.
provider or the family
Mm-hmm.
members.
Right. Well,
And
and when we speak with someone who clearly is knowledgeable, then we forget about that age.
I think that's usually what happens because they may come in and have a certain bias, or they may
Mhm.
look and say, like you said,
Mhm.
oh, how do you know? You're gonna tell me what to,
Right. Oh yeah.
And it's okay. I have learned not to take offense to any
Mm-hmm.
of it. I'm just gonna stay professional and explain,
Mm-hmm.
what I see and what my recommendations are.
Mm-hmm.
But then I always leave it to say, but you're the patient and you can make
Mm-hmm.
your decision based on my
Right. Mm-hmm.
recommendations.
Mm-hmm.
And I leave it like that. I try not
Right.
to force any
Mm-hmm.
treatment on anyone.
Right. Well, and of course, when we're older, most of our providers are going to be younger. I mean, there's just that,
Well, yeah.
when you
Right.
reach, that age, they've retired, right?
Right.
And so, I mean, it's just, but, yeah, I mean, every once in a while, I will have, a healthcare provider who I look at and I think I have shoes older than you. But I've also found that, part of that too is they are more up to speed on a lot of new techniques, new processes, all of those things, because it is less time since they got out of whatever school that they had attended. And then there's the whole technology thing. It was very interesting to me when I was diagnosed with thyroid cancer. I had seen an endocrinologist who said, "You're healthy, go away." I mean, literally, he said, "Shoo." And so, I had this diagnosis. We knew, yes, that the test had come back as, the as positive. We knew this was cancer. And so I reached out to him through the online system.
Right.
And I said, you know how you said, go away and don't come back unless there's a problem? Hello.
Right.
And so I explained, okay, here's what's going on, been diagnosed with this and this and this. And within 10 minutes, boom, he responded. And he is probably one of my younger physicians that I have, and I do have quite a few. But that's just his, he is so used to doing that. Now, granted, a lot of seniors are not going to do that. I mean, they're going to go, we have to go online to do this, but it impressed me so much because, one of the things that, he said almost right away, he said, I'm sad you're back. And he said, but now we're going to take care of you. And I said something along the lines of, okay, I have a surgeon, I have my primary care doctor, I have my oncologist. And his response was, I'm in charge. Okie dokie. Oh, wow. I mean, he said, I work with those other people, especially the oncologist. And he said, but nope, this is my specialty
area.
And so I went, okay, fine. And that was how it was. And it always will be. And it's funny because they have all, the primary care doctor was like, okay, I'm out of this now. Y'all take care. But even my oncologist said, what he says is what goes. But again, that all comes back into this advocacy thing. If we're not comfortable with our healthcare provider, then change if you can. I understand. If you're on a certain insurance, or you mentioned that you are so blessed to be working at the VA. Some people are not, they have to go to the VA if they want care. So, but there are other providers in those institutions where, hopefully they can find somebody that they click with. But yeah, we are the people in charge of our treatment, not our healthcare providers, and heaven forbid, not our insurance companies. And that's a totally different soapbox, right?
Exactly. And as family members, we have to be the advocate for our family members, because if, God forbid, something happens, it's good to have an advocate. It's good to also speak and get your healthcare proxy, get those affairs in order from the
have them in legal writing, folks.
Exactly, because you want to express how you want to be treated, how you know the advanced directives, things that you want to have in place. You kind of want to put those things in place early on, not to say that something is wrong, but it's better to have it in place because it doesn't necessarily always have to be aging. It could be an accident or anything can happen at any given time. So in life, we want to always be prepared in that realm. Because like you said, we want to advocate for ourselves, but when we can't, we want to make sure that we have the right people in place to speak on behalf.
And obviously make sure that they know what your wishes are, especially if it concerns your healthcare directives, because do you want continued care, all of those various things. And it is still sometimes ultimately their decision if you are not able to do that. But if you're not wanting, say, a DNR, if you do not want resuscitated, if you don't want intubated, things like that. They may say, no, we want to keep mom, grandma, husband, whoever around forever.
Right.
But have those discussions and tell them this is
discussions.
why I don't want that. And obviously, we saw a lot of that, especially with intubation during COVID.
Exactly.
And so it was like, okay, is this just to help me breathe?
Right.
Or something different, where it's something that is permanent type of thing.
Right. And even in dentistry, for the simple things such as extractions,
right.
Their informed consent is an ethical issue. So you have to have, if you're not able to, or you don't have the capacity to consent for yourself, you have to have somebody who can stand in the gap, and that's considered quote unquote a legal guardian for you to provide that care. Otherwise, we cannot, even if we see the need,
right,
you can't just move forward without that informed consent. So there are certain ethical guidelines as well.
And that's where, especially if you're in a care facility, you need to have that taken care of, because you might have done it for your medical doctors, but have it for your dentists also. And whether it's that somebody at the community, the facility has that that ability, or if they have to contact a family member or whoever, you need to have all of that in place. And again, folks, we're not it's just it's pretty easy to do. I mean, when I first did my my healthcare directive, I went online. It was really pretty, and it was it was as simple as my husband is I mean, it was like one page. I mean, it was pretty simple. Now mine's a little bit more complicated, but yeah, it's pretty simple to do. And I would hope that those listening are thinking, do I need to talk with mom, grandpa, whoever about that? And yes, you do. If they do, if that they do not have that in place, then talk to them about it. And if they do have it in place, know who it is, because that's the other thing, you see, and we see this all the time, somebody is in an accident, they get to the hospital, nobody knows who's in charge.
Nobody knows.
Right. And so just make sure that you've communicated all of that. And it's tough questions. I mean, you're not wanting to scare them to say, so, but it's kind of, so that's where it is better to have it set up long before you need it.
Right.
And remember it too. I mean, there are things change, like you might have had somebody that, you had designated that's no longer part of your life for whatever reason. And legally, they might still be the people in charge.
Right. So you want to keep those things updated too.
I divorced that person.
Right. With life insurance as well, which I too, provide with the life insurance. I am an agent.
Life insurance doesn't matter in the slightest if you have them on that paper. Yeah.
Yes.
But yeah. Well, oh my gosh, Dr. Hogue, this has been so enlightening and hopefully thought-provoking for everyone, even though it's a little bit different from what we normally talk about. I think we've talked about some things that, are very important here. But tell us a little bit more about Mouth Mirrors.
Okay. Well, Mouth Mirrors is basically an online education platform. We do provide home health products or supplies for patients, family members who may have a hard time finding certain things to kind of help in aiding with the oral care of their aging family member or care, loved one. We have our podcast, Aging Pearls, as you mentioned earlier. And then we also provide I serve as a virtual faculty. Like I said, I've served on faculty for other universities, and we do that virtually as well for other universities, for dental and medical schools, as well as we're opening to some nursing programs. In addition to that, the nursing homes. If anyone is interested in services, we have a 6-week intensive or the long-term 12 months, which is more so for the side.
I love it. So how do people find out more about this and how do they contact you?
Yes, they can contact me on the website, www.mouthmirrorsllc.com. And our contact information is there and they can reach out to us.
I love it. And you're actually about 10 minutes from me, which we just thought was so funny when we initially met, because nothing's close in Atlanta. And and so, we discovered that you were so close, but you are based here in Atlanta. And so again, thank you for your service to our veterans through, because you do work with the VA. And I think that's just such, that is, our veterans and our seniors are those populations that unfortunately we forget about.
Yes.
And so thank you so much for taking care of those folks for us.
Thank you. Thank you.
Well, this has been absolutely wonderful. We've been having such a fun conversation about something that, people don't always think is fun, right? Which that's what's good about this, because we can, kind of lighten it up a little bit. But do you have any final thoughts that you want to leave everyone with?
I guess the biggest thing is oral care is healthcare. It is a major part of healthcare. So don't neglect your oral care. And I believe, I'm not sure the exact person that made the quote, but be true to the teeth that you want to keep. That's not my quote, but an anonymous quotation. So yes.
I love that. So much fun. So much fun. Well, this has been very enlightening, and a lot of fun. And hopefully people are thinking about it. Do you need to talk to your loved ones? Probably, right?
Yes.
And so be thinking about that. Be thinking about your own oral health. These be the only real teeth that you get. You can get other ones, but
right.
And yeah, so I'm Deb Creer. I've been having so much fun talking with Dr. Christie-Michele Hogue. And until next time, everyone have a great day.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.